Well, hello everybody. My name is Emily Bright with DocStyle.com. I'm hosting this webinar on behalf of DocStyle. Today, we'll share more about breast augmentation surgery with silicone or saline implants. At the end of the presentation, viewers are invited to schedule a remote consultation with the doctor who performs breast augmentation surgery. We will also be answering questions throughout the webinar to help you learn more. Okay, so let's begin. Did you know that more than 350,000 women a year choose breast augmentation surgery? This is partly because it's a relatively safe procedure. A big question is often which implant is best to use. This is a decision you should make with your doctor, but keep in mind that 62% of today's breast augmentation patients choose silicone over saline. What it boils down to is this. Breast augmentation is a surgical procedure during which a doctor uses silicone or saline implants to change the look of a patient's breasts for cosmetic reasons. Breasts are enlarged and sometimes the shape and/or its firmness is changed as well. Let's take a look at the technology. Some offices use Crystalyx Virtual Aesthetics, an instrument that allows patients to try on new breasts for size using virtual reality. This step helps patients to manage expectations, make informed decisions about implant type and size, and see what new breasts will look like post-surgery from the patient's own point of view. Women can get breast implants as young as 18 years old. They'll have to be 22 for saline implants, though. Good candidates for this procedure are healthy women who want to change the look of their breasts. This includes women with naturally smaller breasts or women who have had kids. Women ages 30 to 39 make up the majority of breast augmentation patients. Women often choose to undergo this procedure with saline or silicone implants versus other procedures that promise a similar result because this procedure allows for realistic expectations, a natural look, better shape, and desired firmness. It is also an outpatient procedure, which means that patients go home the same day they receive the surgery. This procedure is completed to change the look of the chest and breasts. After this procedure, many patients feel more secure in their bodies and have more confidence. Physically, this procedure can change breasts that are small, uneven, or deflated. Let's take a look at the procedure. Step 1. The patient is put to sleep using general anesthesia. Step 2. A surgeon will make an incision in an inconspicuous area such as under the breast, through the belly button, or in the armpit. Step 3. The implant is placed either under the pectoral muscle or directly under the breast tissue. Step 4. Sutures, skin adhesive, and/or surgical tape is used to close the incisions. Step 5. The patient is wheeled to recovery and woken up. This procedure usually takes 1 to 2 hours to complete. Before committing to this procedure, it's important to understand the recovery process. Because this is an outpatient procedure, patients go home the same day. They are then instructed to rest for a couple of days. After 4 to 6 weeks, normal exercise may resume. It does, however, take about 6 months for the breasts to fall into their final position. As with any procedure, there are risks. In addition to risks associated with general anesthesia, there are risks that come from most any surgery. These include bleeding and infection. More specific to this procedure, patients may experience any of the following: pain and discomfort post-surgery, chest tightness as the skin adjusts, implant rupture, leakage or deflation, rippling, tissue damage, scarring, wound separation, seroma, Mondor's disease, rash or changes in sensation, though many of these risks are rare. It's also important to note that most breast implants last about 10 to 15 years, which means that subsequent surgeries to replace implants may be necessary down the road. The exact cost of the surgery depends on many factors, but the average cost using silicone gel implants is about $5,900 to $7,200. Keep in mind that insurance may not cover a cosmetic procedure like this. If you would like to schedule a consultation to learn more about breast augmentation surgery, click our link to the right-hand side to connect with a doctor. Thank you all for your time.